My name is Bernard Mako, and today we're going to do a very quick sample scan, lung scan, using a Suresult D3 Ultra handheld ultrasound unit. Now, my version of the exam uses 4 points. Basically, why do I pick 4 points? Well, if you look at the lobes, I get this lobe, this lobe, this lobe, and then I pick the bottom corner where fluid is likely to collect. There are many similar protocols. The blue protocol uses 3 points instead of 4 points, and in general, the more points you do, the better. So if you want, you can do the posterior wall, and if you don't like 3, you can pick 4, 5, 6. You can check between every rib if you want. So here, just on myself, I just want some samples of normals to talk about what are we looking for. So we're looking for pleural sliding. So we're looking for, it sort of looks like ants moving along the wall of the cavity. If it's not moving along the wall of the cavity, guess what? You have a pneumothorax. The lung isn't there, or the lung isn't moving. Now, in general, the rest of the appearance of the lung, you don't really see into the lung because the lung is full of air. So pneumothorax and regular normal lung looks the same when you get past the pleura. You do see something they call an A-line, which is just a reverberation artifact, basically sound bouncing back and forth here, makes this line sort of repeat itself repeatedly at regular intervals. And that is actually a sign that's either pneumothorax or normal lung, and then you look for pleural sliding, and if you see pleural sliding, you can rule out pneumothorax. Some people like to use M mode, and they look for the seashore sign. This looks like a sandy beach, and this looks like the water, and that's what you should see. And if you see something more that looks like this, like just a barcode, then that's a sign of a pneumothorax. And again, just check different locations. We see the same thing. We're looking for ants crawling across the pleura. Looking for ants crawling across the pleura. And here, at that corner, this is called curtain sign, because you can't see through lungs normally, right? So what we're seeing is we're seeing the lung basically move, and it's covering up or it prevents us from seeing within the liver. If there was fluid, we would see a corner of hypoechoic or anechoic fluid, sort of a triangle right here. And if the lungs had pneumonia, were full and solid, we'd be able to see through the lungs. So here's just an example of what an effusion would look like. Here's another case where we have consolidation, so we can basically see through the lungs, so we can see the spleen or liver, depending on what side of the body you're on. So this reverberation artifact is considered normal or pneumothorax. If you get something called B-lines or comet tail artifacts, that means the lungs are wet, increases your suspicion for pneumonia. And if you get something that looks like this, basically these lines, there's so many of them that they sort of bunch up into just one giant line. That is also very indicative of pneumonia. I mentioned there's lots of protocols. The blue protocol is quite common. And you can see for the blue protocol, you get sensitivities and specificities, 80s, 90s. So it's pretty good. So I'll take a moment to plug my own website and my own courses. If you want more information, there's a little bit more information in my non-MSK trauma course, which is free, by the way, because I think it's important if you have an ultrasound unit that you learn how to handle trauma. You might as well. And I also go into more detail in my useful non-MSK POCUS scans. So my protocol for the lung exam is basically the blue protocol, and the B in blue stands for bed or bedside. So basically, if someone's lying down, you basically only have the access basically front and maybe a bit of the side, and that's it. If you have access, let's say if they're sitting like this, well, you have access to the back. In fact, you have easier access to the back than the front. So you can add on more points, or let's say you have a woman and there's breasts and bras in the way. Well, you can still check a lot of the lung from the back instead of the front. And if you're looking for something like pneumonia or consolidation, you're going to see that on the back as well as the front. So don't worry about missing the two front parts when you have access to the back. The reason why this is my recommended protocol is because it's just a few points, and the blue protocol is a validated set of points to check. So if I follow that, that means your exam is at least as good as the blue protocol, which is 80 to 90 some percent accurate at finding things like pneumonia and pneumothorax. And that raises another point. Based on your clinical intuition, what exactly are you looking for? You might be looking for different things in the images. If you're looking for pneumonia, then you don't really care about the pleura sliding around. You just care about those B lines or the C line. If you care about a pneumothorax, then you're really looking at that pleura and you're just going point to point. You're really focusing on that pleura. Again, if you have time, I guess you can always look at everything, but you want to answer your clinical question. Is there pneumothorax? If that's your only clinical question, then you're just looking, is the pleura sliding? Are there A lines? Could have A lines for a pneumothorax or for a normal lung. And right, if you find nothing, if you follow that blue protocol, you find nothing normal lung, well, and that they have lung symptoms, well, maybe check for a DVT. Maybe it's a pulmonary embolism, in which case the lung scan shows normal, but they still have trouble breathing. So I'm going to turn on M mode because some people like M mode for looking for seashore sign versus barcode sign. I don't really pay attention to that myself. I'm just going to be looking at the pleura, looking for those ants moving across, and I'm looking for, are they A lines, B lines, or C lines? So around second rib, let's take a look here. So between the ribs, and take a breath. And we can see we have an A line here. We're not getting like comet tail type artifacts like B lines. So we have basically an A line, and we do get a little bit of motion across, and we do get more of a seashore sign instead of the barcode sign. And let's go to the next point. So normally around, I don't know, like fifth, sixth rib. Now this one I can really see it. The first one, honestly, I didn't see the pleura sliding that clearly. This one, you can really see the pleura sliding here. Remember, if you can see the pleura sliding, actually that rules out that 100%, virtually 100% rules out a pneumothorax, because you can't have pleural sliding if the lung isn't attached to the wall of the thoracic cavity. So if you're missing pleural sliding, well, it could be other things. But if you have pleural sliding, that rules out pneumothorax. So we have pleural sliding, so I definitely don't have pneumothorax. So I added more gel, and next point is over here. And again, we can very clearly see pleural sliding, so that's great. And again, we're not seeing these B lines or anything that looks like that, so no pneumonia for me. And if I move down, now this is posteral, lateral, inferior. And I go down until I hit the bottom of the lungs. In fact, I'm going to turn off M mode now. Okay. So what are we looking at? Well, particularly if we can go through a few frames here, we have the liver here, and we have, well, we've rib, we have liver, and we have the lung. This is called the curtain sign. The lung is covering, because we can't see through a lung, so it's covering the liver. And as I breathe, the lung is the diaphragm's moving up and down, and so the lung is moving, and so we see this curtain come across the liver and prevent us from seeing anything. So this is normal. If we can see through the lungs, that's bad. That means there's consolidation and the lungs are full of fluid and junk. If there is a large hypoechoic or anechoic collection of fluid here, when we see it, it's often just this triangle, black triangle, then we would have a lung effusion, or which could be a hemothorax, for example. And that's it. Pretty quick. I'll just add, if you are interested in one of the Suresult handheld ultrasound units, that you can use my coupon code for 11% off. And they asked me to mention that they try their best to make sure that shipping and customs are handled, and they've tried to make sure that they meet a lot of the international standards for medical devices. Anyways, cheers!